I'd like to welcome everyone today to today's Digital Governance and Safety Committee, the public session, which we're holding today. In the interest of time, if I could ask all members of the committee to introduce themselves when they talk. I have received some apologies. Apologies from my fellow independent member, Alistair Class, and our Executive Director, Rydian Hurl, who are unable to be with us today. As is usual, there will be a private session at the end of the meeting. Here we'll discuss matters that are important for the security of individuals' information and the security of networks and systems. And we don't discuss those in public because not everybody who might be interested in this meeting has our best interests at heart. So that will be held in private, but a summary of those discussions will be shared at the next DHCW Digital Governance and Safety Committee. The meeting's being recorded, so if you're watching the recording, thank you for your interest and for taking the time to learn a little bit more about what we do. There will be a short 10-minute comfort break at 2:10. And finally, the public part of the committee is scheduled to run until 3:10 today, with a private session taking place from 3:20 onwards. I'm going to move to the first item on the agenda, which is the declarations of interest. Are there any declarations of interest I need to be made aware of? No, in which case I'm going to ask whether there are any matters arising that need to be dealt with by the committee today. No, in which case we're going to move to the consent agenda. We're using the consent agenda today. All of the items on the consent agenda have been circulated prior to the meeting. I haven't received any comments or matters have been brought to my attention. So unless there are any now that anyone wants to raise. Chris, you have one. Thank you.
Thanks, Chair. It is Chris Darling, Director of Corporate Affairs. It's just to note on the terms of reference, the technical design has been included formally as part of the annual review. Technical Design Authority update has been a standing item for the last few meetings. That's formally now been incorporated into the terms of reference.
That's great. Thank you, Chris. So in view of that matter, can I just run through every item on the consent agenda and just ask, is the committee able to approve the public minutes and the private minutes? Excellent. And can we note the forward work plan that we've all seen? Excellent. We're now asked to approve the Digital Governance and Safety Annual Report, which was prepared for the committee. All good, excellent. And also to note the effectiveness self-assessment that we did of the committee in that report. Thank you. The Digital Governance Safety Terms of Reference, as Chris has just explained, we're all happy with that. Excellent. And approve the committee's cycle of business. Excellent. In which case we'll move now to the main part of the agenda. And the first matter is the action log. There are no actions on the public action log that are outstanding. So well done, everyone. Full marks for that. And we now turn to point 3.2, corporate risk register. So can I ask Chris to lead us in a discussion of the public risks that are assigned to the committee? Thank you, Chris.
Thank you, Chair. Yeah, just to note for the committee, there's currently 17 corporate risks on the corporate risk register. 5 of those are assigned to the Digital Governance and Safety Committee for oversight and assurance. 2, Mark will take us through in private session. And as you say, Rowan, that leaves 3 that are assigned to the public part of the meeting. There's 2 risks which are information governance related. I know Darren's covered these previously, but I think it's important that we get an update on those. And I myself and Darren had an update on these earlier in the week, and we had some discussion around the time it's taking to address these, and some frustration. But I think there is progress being made, but it is one of those things we're chipping away at. So, Darren, if you're happy, I'll hand over to you just to update on the 2 information governance risks to start with.
Thank you, Chris. Yep, I'm Darren Lloyd. I'm the Associate Director for Information Governance and Patient Safety. Not to go through all other conversations that we've had through the committee, but some latest updates, I suppose. In January, we had a meeting with the Chief Medical Officer for Wales and the Deputy Chief Medical Officer and other executive individuals from Welsh Government and from the service as well, including our own Chief Exec and Executive Medical Director, Rydian Hurl, to discuss some of the matters that come about from those associated risks. One, around functions of this organisation, aspects of regulation, and areas of where it's been spotlighted or highlighted where there's a lack of traction in terms of those aspects within those 2 risks, those being aspects of public engagement on the use of Welsh resident information across health and social care, transparency and privacy aspects, and then, as I say, some of those functional responsibilities of organisations such as DHCW. DHCW is not the only statutory organisation with functional responsibilities for patient information, of course. So having discussions with the CMO and putting some traction into some of the actions that I've just described in terms of what are within the powers of government, what are within the powers of the service, to try and help along some of the issues about making sure that organisations have the appropriate lawful basis for sharing data, both from a direct care and an indirect care perspective. When I say direct care, those direct care where there is hands-on responsibility for medical professionals to treat the Welsh resident population, and then the indirect care elements where we use that information in matters of public health management and other associated uses for that. So it was a very good discussion, a progressive discussion as well, where the CMO has some intent on taking some leadership in this area, because we felt that the clinical voice and obviously the professional voice of the health professional is really important, and the CMO wanted to take some leadership in this place. So there are a number of actions. There is the intention of creating a working group at an executive level to try and look at some of these, for want of a better word, wicked problems. And so there are a few actions on DHCW to facilitate that, which we are taking forward. But we have spotlighted that again, and as Chris has said, there's some elements of progress being made in this area, not least because it has been a considerable amount of time since it was first raised, but I think there is some impetus and some a lot more traction for this to get resolved in a more strategic way.
Thank you.
So thank you, Darren. That's very promising. Has anyone got any comments on Darren's update on that risk? I think Chris will just discuss them sequentially, if you don't mind. Thank you, David.
Yeah, sorry. Before you move on, great news that we've got a working group looking at this, Darren. I know this is a how long is a bit of string question, but have you got a view as to when we might resolve this and get, excuse me, to a better position?
There are a number, as you could probably appreciate, David, there are a number of factors to this, a number of layers in terms of the resolution to this. This is about the powers of ministers as well to affect change and to direct the service to do certain things with information. As we know, we are coming up to a period of uncertainty at the moment through election periods, those type of things. So some of the longer term aspects, which is about potential regulation and direction, may take some time. It has always been. It will always take time because these are matters that predominantly need to go through the Senedd, either via primary or secondary legislation. In the interim, there are some service elements that we could consider over the next 6 to 12 months so that we can start progressing this to add confidence into the system and take a slightly different approach to associated information sharing risk. We would hope that we have some traction on that in the next 6 to 12 months, while the other elements are progressing through that more formal route of ministerial responsibilities, and of course the appointment of individuals into the Senedd because of the current status that we're in.
Thanks, Darren.
And I'm really heartened by that, Darren, because we work under the GDPR legislation in the UK, and we've got the Information Commissioner's Office as sort of providing oversight. Nevertheless, it's the Welsh Government who manages healthcare and has to direct the service to essentially operate in a way that meets the law and actually meets the expectations of the Welsh public. When they provide very personal information to their care, the clinical community, they do so for the purposes of care, and they want to make sure it's used for the purposes that they intended it to be. I think the promising thing is there are digital professionals throughout the NHS in Wales in different organisations who, by working collegially and acting to ensure that data is controlled and processed in ways that are according to the data, will actually raise the profile of digital across the NHS, and that is good for the profession, and it's good for the people of Wales, and the NHS benefits from efficiency. So I just say that because sometimes in the minutiae, the bigger picture gets lost. So really pleased to hear that, Darren. Chris, do you want to move on? Unless there's any other comments or discussion points? No, in which case we'll move on to the next risk, please, Chris.
Thanks, Rowan. Just a couple of points on this one, if that's okay to start with. A couple of things. There's the 4 Nations Plus gathering coming up next week across the UK nations, and I know data sharing will be one of the topics. The HCW will be represented there, as will Welsh Government. I think that's important because there is learning to be had from the approaches being taken at other nations. So that, I think that's a positive in terms of understanding and how we can move this forward. And we are arranging a national digital conference for NHS Wales in May, where there is a spotlight session on the power of data, the importance of data sharing, and how other UK and more globally how data has been shared effectively and the impact that has had. So I think the spotlight and the work that Darren's described, there's just a couple of things that are happening over the next few months which will keep a bit of momentum up around this. So it's just to make those points.
And thank you for sharing that evidence, because it also kind of reinforces what Darren's points were just now.
Thanks, Rowan. And then I would just move on to the third and final public risk, which is one the committee is very familiar with. It's CANISC. So it's the decommissioning of CANISC, and we were hoping in mid-February this would be fully decommissioned. There is still some access, very small amount of access to the system for kind of audit purposes. As you know, Riddy, the exec medical director, is keen that this remains a corporate risk, although the score has significantly reduced, until it's fully decommissioned and we don't have people who can access it, i.e. there's still a potential risk because of the how old the software is. So on this one, Chair, I appreciating you won't be here at the next committee, but I know you've had a good few years oversight on this. I would like to bring something back that describes how this will be fully decommissioned, because there is a bit of work to do just to understand if subject access request requirements are needed and the system isn't there, what do we do? So there's a bit of decisions to be made, but we do need to get to a point, I think, where we can say we've decommissioned Canis. So at the moment, it's still a risk, and I know the medical director is looking at this. We've had a conversation, and he's considering options. So that's the update on this one. And if okay with you, we'll schedule it in for a further discussion, and Sam may well want to come in as well.
Sam, would you like to sort of comment on where we are with what is a very obsolete technology?
Yes, thanks, Rowan, and thanks, Chris. So the cancer team in Single Record are currently evaluating what it would take to provision the data which is still in Canis, which is currently used by about 20 people for subject access requests, as Chris has said, and various other legal use cases. So we need to basically extract that data from the Canis system and provision it probably through Power BI or some kind of dashboarding capability that would allow those more sort of analytical reporting use cases to continue, but would completely remove the original legacy Canis product from our estate. So that is pretty close. So we're looking to decide on an option this month, and I think the data migration is not going to be particularly complicated. So as Chris has said, we should be in a position to wrap this up and properly close that risk very shortly.
Well, I'm extremely heartened by that, Sam. As everyone who's been through various committee meetings with me knows, I'm very keen to see that happen. And nevertheless, that data has a value, if only to be able to go back and look at cancer survival rates and some of the performance measures, which is an important aspect of why we collect data. So good to hear that. And anybody else got any comments on Canis? In which case, Chris, I think we've discussed the risks, and we're seeing some progress on some really tough risks. So that's really heartening. In which case, following the corporate risk analysis, we'll move to the assurance agenda and the incident review and organisational learning report.
Thank you very much, Chair. So I'm Keith Reeves. I'm head of SACM and Transition. And this will be the report for Q3, covering the period from 1st of October 2025 to the 31st of December 2025. The report's been circulated beforehand, and I'll just go through sort of some of the highlights across the 4 key areas that we provide in the report. So first up on the reporting front, for Q3 we reported 1 early warning notification. That was issued to Welsh Government in relation to issues surrounding Amazon Web Services and the impact that an outage in AWS had with our e-library. That brings the total notifications that we've issued so far to 6. One of the new things for reporting for this financial year is incidents reportable under the NIS directive. There were 2 incidents sent through to the Cyber Resilience Unit, but following assessment, neither fell in the scope of NIS reporting. But in total, there's been 2 notifications across the year. And then the other area that we provide reporting on is the complaints, concerns and feedback. So we've had 7 complaints in relation to the NHS Wales app, 9 in relation to the dental access portal, and then the remainder were complaints in relation either to DHW business or they were directed to other NHS Wales bodies. And then of the inquiries that we've received, 41 were again in relation to the dental access portal, and 5 were in relation to recruitment, with 18 aimed more at general DHCW services. On the reviewing front, a slight reduction in the number of reports that we've reviewed as a group this year. Primarily, the decline has been as a mix of both the postponing the December meeting but also that the complexity and the scale of the reviews that we're now receiving, they're much more in depth, which means that we get under the skin a lot more in the areas that are being investigated. As such, whilst there weren't individual technical reviews taken to the group, we did have a thematic review which surrounded incidents that were caused by change. This was a key theme that we'd picked up over previous quarters. So the service management team undertook a thematic review to identify the some of the contributory factors in relation to that, and I'll cover that off in a little bit more detail in a bit. The other areas that we looked at were there were 2 program reports. So the scope of IRLG has increased to not just focus on the reactive incidents, but also being more proactive about the learning that can be derived from the completion of programs. So we've had a couple of reports come through for digital maternity, and also Welsh PAS disaggregation. So the move of or the demerger of data for Cwmtaf Morgannwg. So that report came through. There was also a learning report around the emergency planning exercise Pegasus, and then an annual review from service management again around the lessons learned from the ISO 20000 audit. So this is helping to make improvements to our overall approach to the ISO standards. So on the learning front, I've included, as I always do, just a summary of 3 of the reviews that we've received. So the first one is the thematic review. So this was incidents caused by change, and it was looking back over the last 12 months. And what we've identified, 11 of those incidents were directly attributable to inadequate impact assessments or the inability to foresee the unintended consequence of system changes. The group received the report. It was a really well written report, and there is a summary of the lessons learned from that. Primarily, the learning and the follow-up action is around the change management process and also ongoing training. This is also reflected in some of the outcomes that we had with across the ISO audit around the how do we evidence the competency of staff. The other areas, so there were findings around security and access controls, and then a common theme that seems to be coming through, not just with this one, but also a theme within the program reports, is around communication, and communication and stakeholder engagement. And that over the last quarter, it seemed to be coming through more and more in the individual reports. So it's an area that we do well, but also it's an area that we've got opportunity for a lot of improvement around. And then the other ones are more at the process level in regard to change planning and impact assessment and testing. For the bridge end disaggregation, again, a summary of the lessons that that have been picked up from this have been around communication and collaboration, but also the operational space of trying to integrate new infrastructure, creating the challenge for skills and capabilities. So again, another competency, another common theme has been around competency skills, and this is an area I think we will be looking at as we move forward. And then the last one for digital maternity. So this was a program that was established following discovery phase in 2022, and the following reviews of the program, in 2025 the digital maternity program would be closed, and the learning from that, we picked up some really good learning from this, not just about things like strategic frameworks and the contractual frameworks, but again around supplier engagement, so stakeholder management, communication and engagement, and some learning that we've had around the general approach to how DHCW undertakes procurements. So looking at timescales, looking at the level of investment, and also the requirements. And it's been quite clear throughout. It's an area that we do well, but there's areas for improvement around that. The other parts of the report, so the contributory factors framework, this was something that we brought in 4 or 5 years ago, and the learning that we've picked up from that is we're still experiencing incidents in relation to what we call the active domain, but this again, it came out in the change review around competency, around training, around awareness of process. And then the other areas are, we've had an increase in the departmental domain. So this is where data, infrastructure, information, and the applications are at the root cause and a contributory factor for the cause of those incidents. And then again, the external domain. So this is about supplier caused incidents or supplier led incidents. And also incidents that are happening in the health board that DHCW were then involved in the resolution of. The final area is I just want to touch on is around the continual improvement piece. So this is something that we monitor within the group around some of the key improvement areas. It's an area that I think quarter on quarter, whilst it doesn't change in the report, there's always underlying work that's going on. So the change in the target operating model for service management has meant that we've started looking at major incident management in general, change management in general, problem management in general. But also we use this section now about how the group itself can improve. So one of the key things that we're looking at is actually, does the group still fulfill the remit within its terms of reference, but also what can we do to improve to make it a wider organizational learning piece? And what will be included within the Q4 report is the results of that review of how we can take IRLG forward as an organizational learning group, and where we can also derive learning from even more areas of the business, not just looking at the incidents, not just looking at the programs, but also looking at things like the results of staff surveys, or seeing how external incidents or external learning can be brought in for the organization to learn from and continually improve. I think that's everything that I want to cover off at the moment.
Thank you, Keith. Has anyone got any questions? David, can I ask you to lead?
Yep, thanks. Thanks for that, Keith. Good to see we've got some good learning from the digital maternity, which has benefited us. I had a couple of question really about two things. The complaints we've had around the NHS Wales app and the dental access portal. Can you elaborate a little bit on those so we can understand the nature of people's complaints?
Chris, can I hand over to you for that, because that's more within the corporate governance area?
Yeah, so the app and the dental access portal get more complaints and inquiries generally. The trend we've seen is anything public facing gets disproportionately more concerns, complaints and inquiries than any of our other products. A lot of the dental access portal complaints and inquiries relate to not necessarily things that DHCW can directly control. So when will I get on a waiting list? That is a mechanism for getting on a waiting list, but we can't often answer the questions when. So a lot of the complaints and concerns that we receive around the dental access portal involves liaison with the local health board primary care teams to give them a bit more local intelligence, and sometimes a joint response with them. So for Dental Access Portal, it's often around when will I actually get on and see a dentist, as opposed to how, you know, a technical element within the service. For the NHS Wales app, historically we've seen trends with the app from a concerns complaints perspective. Often what we'll see at the moment is around practices where functionality hasn't been enabled, and rightly an understanding that other practices have enabled it. Therefore, why can't I order my repeat prescriptions? That might be a bad example, but why can't I have an appointment with my GP practice via the app? So there's learning from that. Over the last, I'd say, 2 years, we have seen a lot more technical complaints. They're reducing, and we saw a lot relating to identity management without having a photo ID. So the WIVS service, and I need to get the acronym right, which is the Welsh Verification Identification Service. That has reduced a lot of complaints relating to that, because there's definitely a theme around that. They've gone down, but at the moment we do get a lot where there's queries about when and how functionality will be used. I'd like to think as more functionality is enabled, we'll see a reduction in the complaints. I think we'll see a reduction in the complaints in relating to the, to that, but I think we'll see an increase in concerns and inquiries because we'll have more functionality, so that the traffic will be higher. So proportionally, we'll probably get more activity back.
Okay, thanks for that, Chris. If I may ask a supplementary, with regard to the Dental Access Portal, I've not used it myself. I've got a dentist, thankfully. Is it clear when you put your name on there what the process is for somebody subsequently getting allocated to dentists? So are we signposting that, as opposed to people don't see anything and therefore they ultimately get frustrated and complain?
I think the information, I have looked at this, but not recently, probably about 9 months ago, and we did do a lot of work around the wording and terminology. I don't think it's particularly changed. I think we still get the same sort of queries on, I've been on for a few months, when will I see, when will I actually get through? But there's possibly more we can do. And on this, David, I'm happy to bring something back to a future committee that does a bit more analysis, because I'm conscious these are quite high level themes that I've seen, but I think if we dug into the detail over, say, a 12-month period, I'd probably be able to give you a more rounded answer.
I think that would be really good, Chris. Thanks.
And if I might comment on that, Chris, I think the challenge is DHCW was set up with a view of providing enterprise services into the NHS. So it's a, in business terms, a B2B organisation. And then we had the Dental Access Portal and the app, which are, a business to a consumer service. We're providing services to the citizens of Wales. Well, firstly, there are more citizens of Wales than there are clinicians or people working in the NHS. So you'd expect, even if both things were of the same quality, a certain multiplier effect. But I think the other challenge that perhaps we faced is, whereas individuals who are employed within the NHS have an understanding of what a piece of functionality is and how the service works. Actually, as a citizen, it can be opaque. So it's not obvious that maybe that your surgery is a separate organisation to your health board and has an independence of decision making. So Darren, would you like to add something to that comment?
Just in respect of the one item, which is the Dental Access Portal, just as a matter of record and evidence, that DHCW is a data processor for that application. So any decision making on the movement of information within that system or outwardly into that system, or any aspects of that, are not the decision of the HCW. They have to come from the contracting bodies, which are the health boards. So we are only to take instruction from them from that data processing perspective. So that's an important factor to remember. We cannot make individual decisions or DHCW decisions without ensuring that those that have been declared as the data controllers first tell us what is acceptable and what needs to be done from their service provision. I just wanted to just clarify that position, and that is just unique to the dental access portal.
And Darren, that's a great example of why information governance is so important. And also, David, we have a dental access portal where individuals entering information, they might not be being fed into the same process depending how the region is processing the information, or controlling the information and running the process. Chris, you had one more point, perhaps?
Yeah, just on this, it was just to say we did, and I'm trying to remember the time frame. I think it was just over a year ago. We did stand up a public service desk as well to respond to some of the app queries. So that deals with, I think, about 75 to 100 calls a week. So a lot of the traffic from the NHS Wales app specifically now is dealt with through the public service desk function. And just to comment on, Keith referred to the number of concerns, complaints or inquiries in particular that are referred on to health boards, not necessarily about the NHS Wales app or the dental access portal, but I think that does probably demonstrate the volume of traffic that we get from members of the public often and stakeholders who assume, and you can understand why, as a national digital organisation, anything digital is filtered through us initially. That's why a lot of what we do, we refer on to health boards if it's to do with for example, a query on a local system that we're not responsible for. We would then triage that and share it with the health board to respond formally. So there is a fair amount of that we get as an organisation as well.
So I think Keith and Chris, I think there's some real merit in that kind of analysis of bringing back a report that does try and sort of pick apart some of the complaints into those categories and then just look for trends within them. I think that would be a very helpful report to see in the future. So if no more questions, thank you, Keith. I was particularly pleased to see that people are aware of their obligations under the NIS regulations, and you're getting some things brought to you that perhaps aren't directly within scope, but I think it's illustrating that it's top of mind for people, and I'm really heartened by that. So thank you. Moving on next to the next item, and before I do, I'm going to note the report for the assurance of the board, and then I'm going to move on to the information and governance assurance report and ask Darren to present that. Thank you, Darren.
Thank you, Rowan. Again, I won't go through it in minute detail. The report is there for individuals to have consumed previously. Just go through some highlighted elements, those that are mainly within the body of the report and in the appendices. As you know, we set the report out in terms of our own strategy and the aims within that strategy to fulfil certain responsibilities, both our statutory functions as an organisation and then our outward-facing functions to deliver what we describe as the Information Governance Toolkit. On Appendix 1 talks about our own compliance with the IG Toolkit and assurance process that allows us to measure ourselves around good compliance around data protection, confidentiality and other aspects, as well as security and freedom of information. Through 24-25, we had strong compliance with the toolkit. There were a number of actions. We've fulfilled a lot of those actions, and if any have remained unfulfilled, they have carried forward into the next compliance, 12 months compliance. But we have been in a good place from that 24-25. We have since completed the toolkit for 25-26. Again, a strong compliance and area of satisfaction with a number of other actions that we are going to take forward to to improve on that already good compliance area. So we're above the line in terms of our compliance with the established toolkit assurance process. So we'll work through those actions over the next 12 months to try and improve on certain situations. Some of those are around some of our Freedom of Information Act compliance, other things around us actively publishing information in the public domain, which we feel is really important. Also on Appendix 1 as well is aspects of what we describe as information rights. So I've already explained that in terms of some of those Freedom of Information Act requests we receive as a statutory organisation, and indeed subject access requests as well, those where the public request information about themselves. So that comes under that information rights heading. To note, those requests over the last 12 months or from the previous 12 months have seen 100% increase. That has had not only an impact on my team, but also an impact across the organisation, because it requires the organisation to respond to its fullest extent depending on those requests. Certainly from a Freedom of Information Act request, it can be complex and voluminous in certain scenarios where there may be requests for, say, commercial information, other information, financial information, other information that is under the functions and the responsibility of the organisation. So the team have worked hard in order to ensure that we meet our compliance targets, certainly under FOI, and we've seen a slight increase as well on subject access requests, which mainly are ones around individuals who may be accessing their own information from an employment perspective rather than other circumstances of patients, because of course whilst we facilitate digital systems, we don't actually hold or are able to actually extract the information from a patient-facing perspective. But we have seen 100% increase in terms of those information rights requests. We are looking at how we can improve on and making efficiencies in the system to allow us to be more efficient at those, because if the last 12 months and the next 12 months is increasing as we've already seen, there will be a marked increase predominantly through the service. So that's Appendix 1. Appendix 2 talks about data protection impact assessments that we have worked on, and that we have again a duty to make sure that we thoroughly look at any associated risks with us from a privacy and a privacy design perspective through our services that we deliver. So currently we have been working on 31, with 15 new and 11 signed off in this period. Again, I say it every committee. It does give a strong indication of the amount of work that we do and the amount of things that we actually look at as an organisation and make sure that the appropriate assurance processes are in place. So that's another high volume of work that goes through the team. In terms of call volumes, we've seen an increase of call volume, certainly in January as well. Those across the Data Protection Officer service that we provide. That is a service that we provide to primary care, predominantly general practice, community pharmacists, and we've recently onboarded optometrists to that DPO service. So we're seeing increase in volumes on that. Queries around the Information Governance Toolkit as a forward-facing service that we provide, i.e. we maintain and we are accountable for the toolkit as a system rather than actually as an assurance process for ourselves. We maintain that on behalf of others, health boards, trusts, and other NHS contracted services. And then we have other queries that we get more generally around the service and on matters of information governance. So an increase in January there, and we can see that will increase. We normally see an increase around February and March as well, because the IG toolkit is a requirement. It needs to be done by the end of March. And as you probably aware, some individual organisations and individuals themselves tend to leave their homework to the very last minute. So we see massive call volumes increasing because they are toolkit queries. So that's Appendix B. And then Appendix C talks about the matters that we discussed earlier around our corporate corporate risks, around some of those aspects where we are trying to affect change around those legislative and those regulation aspects within Wales. So Appendix C talks about that. And at the very last, The Data Use and Access Act has now come into force. That is a change in the law. That is complementary to the general data protection regulations, and has made some changes to the law where predominantly the structure of the Information Commissioner's Office is changing. So that becomes that is now changed or is changing. Not predominantly, it won't affect the services delivering, but how it's structured statutorily. The Act has affected changes there. Changes around the use of data for research. There's some aspects within the Act around research. Some changes around organisations' responsibility for complaints, and then lastly, changes around aspects of some of the other processes required to actually answer requests under the General Data Protection Regulations. So the DOER Act, we do, as an organisation ourselves, we're looking at any actions that we need to comply with to change our current processes, our standard operating procedures, to actually take account of the new Access Act. I shall stop there for any questions, but that's a quick run through of that particular report.
Thank you, Darren. And I think I just will share for the record that we have seen elements of this discussed at a recent board development day. So, this is a very comprehensive report, and thank you for that. David, would you like to ask some questions?
Thanks, Rowan. Thanks, Darren. Darren, with regard to this significant increase we've seen in FOI requests, you hinted that some of those might be companies seeking information that might help them position themselves as a supplier, possibly. How much of the increase is down to that type of request, and how much is down to individuals requesting information? Do you have any insight?
I think predominantly, David, without giving you exact numbers and figures, then we have seen an increase from those commercial entities. Sometimes we don't actually know who the requester is, because FOI is applicant blind. So it means that yes, and sometimes we may want to ask the identity of those individuals, but there is no there's no requirement on them to actually reveal that, other than having an identity in order to respond back to, and so it is applicant blind through the law. So sometimes that does come up front, and we know those organisations, and predominantly we may get those requests on an annual basis, because it is about understanding the business that we're in, and whether there's a market position to take in terms of commercial value and financial aspects to it. So it is. It does increase, I would say, over 1 or 2 quarters, predominantly, mainly around the end and the start of a financial year. And then other FOIs they take forward depending on the circumstances. So we've seen an increase predominantly sometimes with the launching of things like the NHS app, for instance. There may be aspects where we are in the frame for some level of responsibility technically, so that might increase. So it can depend, actually, David, but predominantly we do see quarter 4 and quarter 1 of the financial period increase in some of that commercial kind of aspects of the way the FOI requests lean into our responsibilities.
Okay, thanks for that, Darren. Supplementary, if I may. So if the requests again are clustered and we've got a service level agreement, are we putting undue load on the team with this volume of increase and the fact that some of them are bunched together in order to meet our SLAs in this regard?
There is a loading aspect to this, David. Yes, I will agree. And it's not just a loading aspect onto the teams. It is those teams or those individual departments that then have the duty to respond to subject matter experts. And so we will see that in terms of our commercial and our procurement team, our finance team, and sometimes our workforce and OD team have to then we have to put some load on them to respond within the statutory time frames to those individuals who've asked the question. There are certain exemptions in the Act in terms of the amount and volume that we can respond, whether it's over an appropriate time scale, an appropriate time frame, and the number of person hours it takes to actually respond to those things. But they are relatively high bars. So by the time you actually go through the process of understanding what you've got, you've almost gone through that process anyway. So there is an impact, not just on the team, but wider into the organisation under those circumstances that I've just described.
Okay, thank you for that, Darren.
And Darren, I'll just comment, we just heard from Keith in the incident reporting and learning around sort of commercial contract management, supplier management. You wonder whether there's a link here and whether there is something we could do in terms of supplier or would-be supplier engagement and open day that might pay off in a reduced level of these types of requests. I don't know. Sam, you have a question.
Thanks, Rowan, and thanks, Darren. It's more of a comment than a question, really, but just and it's slightly beyond the scope of Darren's report. But as we were referencing the DHCW's compliance with the IG toolkit, it was just to reflect that we had a conversation in the National CSIRO and Caldecott Guardians Forum about the all Wales compliance with the IG toolkit, so for all organisations across NHS Wales, and that is somewhat patchy. So there was a discussion had about whether or not we should be looking to make adherence to the toolkit mandatory for organisations, which it currently isn't. And I think there is an appetite for doing so, but it's not really clear at the moment what the governance mechanism would be for us to be able to bring that about. So just wanted to reflect that conversation, really.
I think that's a very timely interjection, Sam. I probably can speak with a measure of freedom, since this is my last meeting, that organisations that have access to people's personal information who are not compliant with our primary toolkit for assuring information governance, I find it hard to then accept that they have access to that information. Of course, they must have access to that information for the delivery of care, but it does seem rather at odds with itself. I'm dancing on the proverbial needle there, angel kind of, or perhaps I'm Schrodinger's cat, but I'm finding those two positions very difficult to resolve. Rachel, you had a point.
Apologies, it was just a comment in relation to the discussion around FOI requests and intelligence that we can perhaps call upon to inform how we can be a bit more proactive in that space. So it's just to say that the information team, and we work quite closely with Darren's information governance team as well, obviously, but we do look at that intelligence, and we look at the data requests that come into our service as well. And as you're aware, we're an official stats producing body now, so we try and utilise some of that intel and some of those more bespoke requests to help inform what our plan is for what we can push into that official stats publication space to avoid some of the more unique bespoke requests. If we can see that there's some tangible demand in a particular area, then that's where we want to focus. So we are trying to keep our eyes on the types of requests coming in to be a bit more forward thinking in that space.
That's really good to hear, Rachel. And I think I have one question before we move on, if no one else has got a question. Darren, I just want to turn to the sort of Data Use and Access Act, and how ready do you think we are for the Act? It's now in law, and particularly as it relates to data for secondary purposes. You talked about research, for example. Do you foresee any additional workload or any additional compliance challenges for the organisation?
I would probably take it a slightly different direction. Say there are more opportunities through some of the things that the Act actually describes. The devil is in the detail, of course, and some of the guidance that follows through that in terms of those research aspects are yet to come. And I know the ICO are working hard in order to provide some clarity on the interpretation of how the Act sets down some of those research elements. So there is an opportunity, but of course that comes with that is some of the other lawful aspects of ensuring that the research is used appropriately, and we have a lawful basis in the first place to do the collection and the processing as well. So there are some opportunities that are described in the Act, but as I say, some of the guidance in terms of organisations' responsibility, certainly in our research and innovation space, is the important work that comes afterwards. But I think the interpretation of that will give some opportunities, I think, for organisations like DHEW and the wider aspects of health and social care sector that are involved in this particular area of work.
That's really good to hear, particularly in the light of the Health Data Research Service and the investment being made. I would reflect that there are huge opportunities to create very valuable innovations associated with this data if we can make it available in a secure, safe and compliant manner. So that's good to hear.
I think the Act is trying to take a more open stance to research because it understands the kind of the reflective position of where there are a lot of organisations and a lot of service improvement can come from that particular area. So there's a more open stance within the law, which is welcome from my perspective.
No, I would tend to agree. So thank you, Darren. And if there's nothing more than that, I think we have discussed it with your report with enthusiasm, and we are noting the report for assurance. So thank you for that. And now I'm going to move on to 4.3. I am running a little late because we started a little late, mainly because of my IT issues. So Rachel Powell, if you could introduce the Information Services Assurance Report, please.
Of course, thank you. So yeah, I'm Rachel Powell, Associate Director for Information Intelligence and Research. And I'm going to start by taking us through the Information Assurance Report, which primarily discusses the work that we're doing in respect of providing assurance around the information processes that we've got in place within DHCW. So quite a brief overview, but since November 2025, the ISD Assurance Group reviewed 9 assurance quality plans. We had no requests for change this time and no safety case and readiness reports. A lot of the focus for myself and lots of teams across DHCW has been around completing milestones for the IMTP, and we delivered everything to plan in Q3. We've got 54 outstanding information milestones for Q4, although we've got a high level of confidence of delivering those by the end of the quarter. So teams are very much geared up to complete those, and there's a lot of effort at the minute to get the final things tied up and finalised, but everything in plan. We've also had an internal Kaizen event, and I quickly Googled it because I forgot what Kaizen actually meant, but Kaizen is a Japanese term for improvement or changing for the better. And we held that with, it was facilitated by a quality team and a few colleagues from around the table actually. So information governance was prevalent in those discussions, as was data standards, and some of our colleagues from across the National Data Resource Programme as well. And we were essentially talking about how we can improve the process for different data requests coming into the organisation, appreciating that we do have different front doors and different teams. We've also got the DHCW applications themselves where some requests could potentially come in. So we wanted to really unpick some of that and work out how we could improve the governance routes to ensure that we've got a really robust, safe way for requesting information that's facilitated by the correct teams in the right way. And that was mapped out, and it was a 2-day quite an intensive event where we did map out all the current processes and utilising all of the intelligence from different teams to work out what a more coordinated pathway would look like. So colleagues are in the process of writing that up now, and we've got a few tests to take through, but some good improvements made in that space. So that was very positive. We've published the Welsh Clinical Portal usage dashboard recently, along with the phase 1 rare disease dashboard. We've also updated the urgent and emergency care dashboard, and I wanted to flag that dashboard in particular because we produce monthly usage stats of all of our information products that we report up to DHCW's management board. And for the last 12 to 18 months, the cancer dashboards have been at the top of that list, but following the works to the update the UEC dashboard, that surpassed that during the winter months. Perhaps unsurprisingly, it's one of our more popular information products during this time. But yeah, that the utilisation of that dashboard's been very significant, and we've reported those statistics up to the management board as well. And then finally, just to report on some of the assurance work we're doing around the Power BI Pro licenses. I've discussed that a lot within this group in terms of the assurance work that we undertake with regards to making sure that people who've got those licenses are publishing information appropriately and they're aware of the permissions that they have. And there was some unintended breaches, unfortunately, last year that we rectified and got ahead of. And as a result of that, we put some proactive plans to audit all things that were published under those Power BI Pro licenses. So we've also set up a skills group on iPassport now, just to monitor some of the updates that come out as a result of the Microsoft updates that might impact those Power BI Pro licenses as well, and the enhanced user permissions that are in effect out in DHEW, and making sure that we keep an eye on what's happening. So that's been launched as well. And there's no risks or escalations to report to DGNS committee either. And I'll pause there for questions.
Excellent, thank you, Rachel. Has anyone got any comments? David, would you like to lead?
Yeah, thanks, Rowan. Thanks for that update, Rachel. I'm interested in what you were saying about the usage dashboards, and sounds from what you said and what's in the report that we've done some analysis around those, which provides some insight. And you've said that flows upwards to our management board.
Yeah.
What's the nature of the insights, and do we share those with the health boards? What's the sort of...
we have monthly performance statistics that we monitor across all of our information products to work out how those products are being utilised, and it does, just the hard figures aren't enough, unfortunately. Sometimes you do need to get under the surface, because there's obviously some very bespoke information products that we produce for some very niche purposes that you wouldn't expect to have high level of usage. However, some of the more broader products, such as the urgent and unscheduled care dashboard, you would anticipate that would have a broader usage, for example. But it's our way of monitoring how those products are being utilised across NHS Wales. We also monitor who's utilising them as well, so we can break that down by health board, which helps to inform some of the exec to exec conversations. If we know that there's products available and health boards are struggling in a particular area but they're not utilising that product, it helps to guide a conversation in that space perhaps. We also monitor the number of requests, as I mentioned earlier, the bespoke data requests that come into the team. So as I say, that helps to inform a plan of how we might want to push more publications in that space rather than dealing with ad hoc requests. And we monitor the stakeholders as well, and the breakdown of our products. So is it industry? Is it Welsh Government? Is it health board users? So we just try to keep an eye, and obviously feedback as well from users. That's a really important thing that we've been majoring on in the last year, to really get a sense of, it's not just how quickly we can produce these things and launch them, but actually what impact are they having and are they useful? And we're constantly monitoring that and keeping an eye on how quickly we're dealing with requests, but importantly, have we addressed the user needs, and are we answering the questions that people need us to? And are there opportunities to bring in more data? And that's obviously a more compelling case if people are coming to us saying, this was great, but actually what would really enhance it is if we had this data as well, so we can pick that up and take that forward. But that's the type of information that we report up to DHEW Management Board through the monthly performance report.
Excellent. Okay, thanks, Rachel.
Thank you, Rachel. Chris, did you have a point?
Thanks, Rowan. Yeah, I've got one question for Rachel. Just to comment on David's point, I think it's really important, this work, and that we're getting into the usage and can see variation across health boards. And I think the intention is to start sharing that. There can be nuance, and I know Sam's involved in service management in terms of how we're collecting information about our products and how they're being used. So we're on a bit of a journey, but we're starting to look at it with a view, David, to share that, to drive some of the conversations that need to be had, because I think once you see the information, it drives a different conversation.
Yeah, that's where I was trying to get to. So thanks, Chris.
And then question just for Rachel, is the 54 milestones for Q4, because that's quite a lot, isn't it, 54? And I know ISD, you've got a lot of really helpful, talented people in the team, so you get a lot of requests, don't you, from, well, within DHW and from partners during the year that aren't necessarily factored in to the plan. I'm just interested, is that still the case, and will that impact on achieving those milestones this year? And are you confident going into next year that we've got the balance right between what we're setting out to deliver, taking into account we will continue to be asked to do things because of the talented, helpful people you have in the team?
Thank you for crafting your question in that way. Yeah, we do have a level of confidence, and I think that we've learned the hard way to ensure that we craft our milestones in such a way that we can deliver the expectations on us. So as an example, the Value in Health programme, we've got a really robust relationship with them. We've just completed with SLA actually, and they've doubled their ask on my team because they can see the value that we're adding, which is fantastic. And we have monthly check-ins to make sure, because you know that the nature and the asks throughout that program of work change on a monthly basis. So I think the milestone that we have in our IMTP is deliver the asks of the Value in Health programme and deliver what they need us to. So that's a 12-month milestone. We will deliver that by the end of this quarter, because we know we've been monitoring that throughout the year and there's been no issues, and they've asked us to do more, and they've increased their ask going into the SLA for next year. So we monitor these milestones throughout the year. It's not just, I didn't want people to think that we backload everything into the final month and then we deliver it. These are actually on tasks that, you know, there's ongoing delivery over the 12 months really. It is true what you say though, we are a service where we deal with not just requests from DHW teams, but actually quite a lot of what we do is external. And we do have to say no on occasion, and you know, over the last few months in particular, where people were saying we've got a bit of underspend, can we throw some money at your team and ask you to deliver these things? We've had to take stock and say we're absolutely at capacity. We don't turn anything away without considering it first. You know, if there's priority, for example, you know, the urgent and unscheduled care work, and you know, to support winter pressures, we'll always try and prioritize where we can, but we do have to say no on occasion. But we're also, you know, I'm really pleased that we've been able to build some capacity within the team, and even in the research and innovation space as well, which I'll come on to in my next report. But we've seen the value of having a dedicated data analyst in that space, and we've built that into the team going forward to provision some of those types of requests to support the research and innovation ecosystem as well. So it wasn't just borrowing from the information services team where I could and where there was a little bit of capacity going spare.
So Rachel, I think that just shows kind of, you know, what a great job that the group's been doing, and I'm really kind of I'm going to encourage us to come up with those sort of dashboard reporting around, you know, services, and because even if it's not perfect to begin with, and we know this from the last sort of few years during our private sessions, you know, we've gone back and forth on what we should be reporting on to make sure that we're really, you know, focused on the critical pieces. And I think the other thing is Power BI does make it quite easy to put tools together, but that monitoring of usage is really important, because what we don't want to be is in 5 years' time with a long tail of tools that need to be maintained but aren't really useful. So I think that's, you know, I think that's really very assuring for me to hear that, and thank you for that report. So we're late, bad chairing, but I think we all deserve a cup of tea. So if we return at 2:30, we'll begin the second part of the meeting. Thank you very much. Welcome back, everyone, and we'll move straight into agenda item 4.4, and welcome Rachel back for her second act, the Research, Innovation and Knowledge report. Thank you very much.
Thank you. So yeah, this report's in respect of research information, research, innovation and knowledge, and the assurance around the processes that we have in place for those things. So the main thing to report on our committee today is in respect of the refreshed research and innovation strategy for 2026 to for the next 3 years. It's a refreshed strategy, it's not a rewrite. I'm at pains to emphasize that, because it's really to reaffirm a commitment that we set out 3 years ago on our first DHEW R&I strategy. We still have those 4 strategic objectives, but we've tried to uplift them to reflect the more mature state that we're in now. When we started off, it was a brand new function. It was the first strategy for DHEW, and it was really about building foundations, putting in place appropriate governance and setting off on that journey. I'm really pleased to say that 3 years on, we're a lot more established. We've done an awful lot of work in terms of engagement, getting my name out there, building my brand, and really refining what our offer is. And we are in a unique position as a data and digital organisation within the NHS ecosystem for research and innovation. We're not competing with health boards, we're there to support the existing infrastructure, but there's a lot that we can do in that space in terms of the data and digital offer. So as I say, the research and innovation refresh strategy is to reaffirm a commitment in that space and to set out the path for the next 3 years. And all of those areas are reflected within the INTP as well. So we've had to work in parallel with the INTP planning process in order to make sure that we're sufficiently marking out what areas of focus are going to be. There's also flex within the strategy as well, because it's worth noting that, you know, we don't know what's around the corner. We've got a fair idea of where we want to branch out into, how we want to prioritise our work and what we're offering is. But, you know, as colleagues will be aware, sometimes that, you know, we have to be quite responsive to what opportunities present to ourselves. So yeah, that's hopefully highlighted in the research and innovation strategy. But yes, want the committee to note and approve that if possible. I also wanted to pick up on the Digital Economy Act accreditation. We've spoken about this previously, but we did a bit of work recently with the quality team to review the outcomes of the accreditation and the approval that we had going forward. We wanted to align it with consistent DHEW practices in terms of how we set ourselves up for forthcoming reviews in terms of quality standards, etc. So we are working quite closely with the quality team to try and move all our evidence around the different control areas onto iPassport. And we've also got some indicators of what we think the focus is likely to be for the September 2026 DE accreditation review. So we're already starting to get ahead and start to align our evidence, and where that evidence already exists in iPassport in respect of other standards, we want to align that and try and smooth out some of that process as much as possible. It's a very onerous and time-consuming process, but very well worth it. So something we're keen to actively take forward, but in a much more sophisticated way where possible. I mentioned previously about the organisational change process that we're taking forward. So we're currently out to consultation with the teams involved, but essentially it's around strengthening what we're offering and what capability and skills around research, innovation, e-library services provision, and also knowledge management, which is a relatively new area within the organisation, something that we're actively trying to promote and build. We see the allegiance between those teams and actually the continuation from, you know, having that robust evidence, the research side of things in terms of generating new evidence and generating new knowledge, and then through to the innovation, you know, how we can generate new value, and obviously the knowledge mobilization piece, how we can embed that within the practices within the organisation. So there's a really nice continuum and piece to and story about bringing those teams together, and I'm very fortunate that that's been seen in a really positive light. So we've put the new structure out there in terms of, you know, what capacity we'd like to build within the teams, what that offers, and I mentioned around, you know, having some specific provision for data analyst within the R&I space, because we have borrowed and stolen from some of my other teams, but we've seen that there's enough work there, we're generating interest, we're bringing in more projects, so we can afford to wash our face in that space, and we can afford to build some capacity. And I know I've had conversations at this committee previously around what was my intention and how was I planning to grow the capacity within the team. So fortunately, that's where we're moving towards. So that's a really exciting piece, and we're hoping to have the OCP concluded and all of the posts recruited to by the 1st of August. So we're still working to that target. I hope there's not going to be too much slip, or any slip at all, rather. And as I say, that's been positively received by the teams involved. So yeah, and also the research and innovation boards really getting behind that as well. We've also done quite a bit of work in the innovation management space. So myself and a couple of colleagues have recently completed the ISO 56001 innovation management professional training. And that's really how we can we feel like we're starting to get quite well established in the research space, but in the innovation space, I think there's still some scoping out and really trying to define what we're offering is. And part of that's because as a data and digital organisation, arguably everything that we do could be argued as innovation. So we're trying to scope out what an innovation management system looks like, and how we can support the work of the organisation and take forward innovations in the right way with the right constructs. We've also done some exploratory work in terms of kite mark accreditation, and we've got a pre-assessment scheduled for the end of this month, just so we can see where we fare against the standard and see if that's anything that we'd like to persevere with and to take forward. But in any event, I think it's a really positive step to take to kind of work out where we fare in terms of where organisational maturity against that innovation management piece, and we will strive to work towards that standard, whether we take forward the formal kite mark accreditation or whether we just use the standard as the benchmark that we want to work towards. So yeah, that's a really positive thing that we're taking forward. Lots of engagement across the various teams, eLibrary, R&I, and that knowledge management space. And engagement very much underpins the work that we take forward. And as I say, there's a lot in terms of building our brand and generating the work that comes into the teams. Just two things I wanted to call out in particular. We had the Bevan Exemplar Showcase in January, where for cohort 9, we had one of our members of staff undertake the Bevan Exemplar programme. So he presented his work at that on unequal age and health inequalities in older patients, and that was really well received, and he's went on to publish some work in that space. That's very positive. I also wanted to call out the community of interest group in the eLibrary space in particular, in terms of the work that's happening to monitor the US administration and how that might impact some of our information resources and the availability of those resources, as there has been some withdrawal of some information and some hiding of things. So it's good to see that we're being proactive in that space and trying to get ahead of it and just keeping an eye on what information resources may or may not be removed, and making sure that colleagues are aware of the impact of that.
And Rachel, on that, you may know that things like PubMed, there is always a European mirror of tools like that, where they're not impacted by
absolutely, and
those decisions.
Absolutely, and that's the type of information we'd want to share with colleagues, so that if they're appreciating that something's been removed or is absent all of a sudden, we can redirect to what other resources exist. We produced an AI policy for information discovery and use towards the back end of last year, and that's been marked as mandatory reading across DHEW. So it's on iPassport, and we are monitoring. We are monitoring use of that in terms of compliance. And we continue to progress the open access work as well. And I know colleagues and the e-library team have previously presented at SHA board on the work that we're doing in respect of the the open access policy repository and the feasibility study, and what we're doing to try and support more publication and pushing more into that open access space, which again aligns with where knowledge management and mobilization and utilization of different evidence sources. So that's really positive in that space. Finally, there was just two escalations that I just wanted to bring to the attention of the committee. The copyright license agencies confirmed that adding the generative AI to NHS licenses would incur 7% increase in the costs to some of our e-library resources, and just flagging up because there's been a lot of discussion at the e-library service management board in terms of how we can utilize more of these wonderful tools that are available to us, but we need to monitor that with some caution and just appreciate the copyright license and implications. So there's lots of ongoing discussion with that, but just flagging that for attention. And also a commercial escalation, which I think has actually resulted in a positive outcome. But there was a lot, politely, I'll put it, negotiation with Royal Pharmaceutical Society in respect of some underutilised modules in respect of the Medicines Complete subscription. We flagged that up, and as I say, a lot of to and fro, but we've managed to conclude those negotiations now, and which it's resulted in a cost saving effectively. So I think that's a positive outcome, because we do want to make sure that the limited resources that we have in respect of e-library in particular, we're utilising in a really important way. We want to get the best use of those resources across the system, and we do monitor usage again in terms of how those resources are being utilised and where they're underutilised or where there's not a compelling case of that. We'd rather reinvest in other resources that the system requires. So that's a good example of that, really, that I wanted to flag to the board, to the committee. And I'll pause there. Thank you.
So a very firm outcome to end that report on. Thank you, Rachel. David, would you like to make a comment?
I would indeed. Thanks, Rowan. Thanks, Rachel, for the update. I'm really pleased that you're managing to secure some additional resource into the team. As you'll remember from previous comments I might have made, I've been encouraging you to grow the team. So I'm really pleased you've managed to secure some additional headcount. I still think there's huge opportunity in this space, so I would encourage you to push as hard as you can. You certainly got the support of certainly me as a independent member and some of my other colleagues, because I think there's a lot more we could be doing in this space, particularly with access to the NDR and the data that will now start flowing into that. So please keep up the good work, and you have this committee support to do as much as you can in this area.
Thank you.
So I would obviously echo David's comments. Rachel, really pleased to see the refreshed research and innovation strategy. That's good to see. Keep going on, but I think there's a lot of things that you're handling. So thank you very much for that, and for providing the assurance that you do to this committee. So I think we've noted those excellent reports for assurance, and I will move on to 4.5, if I may, and ask for the Wales Informatics Assurance Group report from Jamie.
Yeah, thank you, Chair, and good evening all. My name's Jamie Manning, Quality Manager in Regulatory Compliance in DHCW. So the Wales Informatics Assurance Group continue to provide oversight to ensuring that all services developed or procured by Digital Health and Care Wales undergo proportional risk and assurance assessment. Key performance and project updates. So during this reporting period, several high-profile projects successfully achieved go-live compliance with full WIAG and medical director approval. And these consist of secondary care, electronic prescribing and medicine administration systems for both PUMTAF and Betsy University Health Boards. Also, LIMS 2.0, that's also known as the TCLE system, Tranche 2. So this is a critical upgrade for the laboratory information management system to ensure service continuity across Wales. Tranche 2 consists of cellular pathology, andrology, and mortuary disciplines within the LIMS system. So currently, cell path and andrology have gone live across Wales with great success, and they're doing well. And I believe mortuary are due to go live next week in Anira and Bevan, being the first to adopt, and then after that it'll roll out further. And we also had AWS cloud migration. That was the strategic adoption of cloud infrastructure for the EMIS web clinical system. And currently we sit at 26 projects that are actively pursuing assurance through the new digital pathway. We're seeing a significant increase in the volume of projects seeking assurance, which reflects the accelerating pace of digital transformation across the organization. As far as escalations go, there has been one matter for escalation for this reporting period for your attention. There was one instance identified regarding the single vaccination project, which proceeded to go live without formal approval from the executive medical director. But upon investigation, the project did obtain input and approval from the full 20 assurance leads that sit on WIAG, but it was the WIAG power-up process that was not fully completed prior to deployment. This has been retrospectively addressed and the required documentation completed and formally recorded within the Power App. From this, engagement did take place with the project team to reinforce the adherence to the agreed WIAG governance pathway, and appropriate reminders have been issued to ensure future compliance prior to projects going live. But it has been determined at this point that no further action is required. However, it does reinforce the importance of that end-to-end process completion before we deploy into live environments. Finally, I wanted to talk around continuous improvement, and Kaizen's been mentioned a lot here, but we're actively looking to evolve the WIAG framework to ensure it remains an enabler and not a barrier to innovation. And as I mentioned last time on the meeting, WIAG would undergo a quality improvement using the Kaizen methodology. So this has been done. We did it over 2 in-person workshops, which had representation from all involved parties, so both the assurance leads and project management. This identified multiple pinch points and issues users face with the process, but it also generated really good ideas and ways forward on how to fix and improve. So all that now has been collated, but it's not yet been sent out for review or implementation, as we're also currently working alongside a company called Reply, who badge themselves as industry experts in agile alignment. And this is to review the current process alongside the proposed changes highlighted from the Kaizen event to ensure that the WIAG assurance model can support modern incremental software development without stifling the speed of delivery. So that's currently ongoing and is traveling in a positive direction. So we're looking forward to the kind of output of that. But one main key I did want to highlight is behind improving the WIAG process, it lays now with the data we can now pull on, transitioning from the old process of having AQPs and safety case reports submitted. So we can actually pull data now from the Power App so that we can improve using decision and changes that are data driven, and being able to gather that data in addition with the SMEs that sit on WIAG should allow WIAG to adapt when needed to this ever evolving landscape in the digital space. And it also allows us to establish key performance indicators to monitor via dashboards and drive the speed and quality of assurance workflows. So yeah, there's a lot of work currently underway in the WIAG space. And the aim is to agree and finalize and put together an implementation plan with this by April. So thank you. I'll stop there with WIAG.
So thank you for that, Jamie. That's really encouraging. Does David, do you want to start with a question and we'll?
Yeah, I do. So Jamie, thanks for that update. Just wanted to probe a little bit around the non-compliance around the go live of the single vaccine project. I'm assuming we've got some sort of process in place that says you need to do this before you go live. So how did we manage to sort of skip a step in the process?
So it was understanding of the process in of itself. So they understood they needed to come to WIAG. They needed to, they understood that they needed to seek assurance from the 20 different areas, which they did. Essentially, it was not understanding once that was achieved, it needs to then go to our executive medical director for review and kind of final approval. So they did follow the process up until a point.
Fine, and then the step that they would presumably weren't aware of, otherwise
yes.
I would hope they would. Yeah, okay, fine. So no further actions required, which I'm happy with. Is there something that we could do to make sure that doesn't happen again, though?
Yes, and this is part of the whole improvement round WIAG. It's making sure that we are looking at all of our SOPs, our guidance, communications. It's also highlighted that we probably need to do a refresh attend talk that's organisational wide, surrounding not just the improvements we want to make, but actually the WIAG process and the adherence too.
Okay, great. Thank you, Jamie.
Yeah, thank you for that, Jamie. And Chris, do you want to follow up?
Thanks, Ryan. Yeah, just a question on quality improvement and the Kaizen event, Jamie. And I'm conscious we've mentioned quality improvement and Kaizen events a bit through the last little section of this meeting, and the capacity within the team to support those, because it's great they're happening. You've got the capacity to continue to do that across DHCW?
To a point. Paul Evans is running quality improvement workshops with aid from our other staff. It's not just the Kaizen events, but it's the principles of quality, 5 minutes improvements. There's kind of a package that we're running. But at the moment, we don't see any issue facilitating these Kaizen events across the organisation.
Excellent. Marilyn.
Thanks, Jamie, for a great report. I just wanted to follow up from what David said. So we did follow the policy, but there was something that in the process that we weren't quite aware of. It's just to be assured in the future that that won't happen. Obviously, there's no further action in this instance, but we've obviously learned from it. And so it is there sort of... can we be assured that actually the process is in place now so that wouldn't happen in the future?
Yes, it's gone out, and hopefully we shouldn't get to the point now where people aren't aware of the process in its entirety and what constitutes as, and this is why what we're doing for WIAG as well is that we're putting together a definition of ready and a definition of done, so that people are well aware of what they need to do to come to WIAG, and then when the WIAG process has finished. But a lot of what we're trying to do with WIAG as well is the data is telling us a lot of this work doesn't necessarily need to be done at WIAG. What we need to do is arm the project managers with this knowledge and almost the checklist. So before they even come to WIAG, they're able to work their way through the assurances, understand the scope of assurance they need. Because that's the other thing, we want it to be scalable. We don't want everything that doesn't need the full assurance to go through the full assurance. So it's defining what is the entry criteria, what's the kind of risk matrix look like for that scalability, and then it's arming the project managers with the correct information of what exactly that assurance area is there to do, what they want, how to complete the required actions, and what those next steps are.
Thanks for that, Jamie. Thanks.
Yeah, Jamie, I think you're what this report made me reflect on was, as we've changed our operating model to become more agile, now we have the assurance group who are also in transition, becoming more agile. Lots of opportunities that you touched upon really, or implied in your presentation, to use data to generate some sort of assurance. I think then coming up to this committee is thinking about how you can report on top of that data to provide the committee with insurance. So I'm going to bang on about my a dashboard and the key KPIs. I think that the piece for me is the bit that I find slightly worrying that David picked out, which is, you can't digitize Mr. Hull. Our budget won't run to a 3D avatar of Mr. Hurl, and ultimately, you know, part of Ridian's role is to make sure we have that safety cover for the system. So I'm, you know, I think how do we make sure that even if people don't know what the assurance process is, there is some control measure there. Sam, you've got a comment to make on that point, perhaps.
Yeah, thanks, Rowan. I think, as you've said, we're transitioning to a new operating model, and a big focus of that is working in a more agile way. And obviously, the ultimate aim of that is to speed up our delivery. So, I think, you know, our ultimate aim should be to automate as much of our assurance as we can, really. And Chris will touch on some of this in the TDA report shortly. But you know, it's about moving towards predefined blueprints and self-service against those, so that really a lot of the assurance is pre-done. So you're deploying from a pre-assured template, which then means that where a human needs to be in the loop, their effort can be directed into the things that we can't rely on technology to do, such as, you know, possibly aspects of clinical safety or ethics and so on. So you know, we're moving towards a much more streamlined assurance model, I think, but we've got a long way to go to get there. You're on mute, Rowan.
So I'd absolutely concur with that, and but we certainly have started, and again, the comments I've made, Jamie, I encourage you to bring something to the committee, even if it's not in its final form, because I think, you know, discussion of what goes into that report amongst this peer group would be helpful, and you know, just by using it, it will improve. So. Really good report, and thank you for that, Jamie.
Thank you.
So I think we noted for assurance the WIAG report, the Wales Informatics Assurance Group. I always say don't use the acronyms, and move on to 4.6, which in my notes, Sam, says it's going to be led by you, but perhaps it's a team effort. I don't know.
Yeah, thank you, Rowan. I will just hand over to Chris to present this item, if that's okay. Thank you.
Yeah, absolutely. Can you hear me okay?
Yes.
Okay, hi, yeah, Chris Collis, Chief Product and Technology Officer. So I'm just presenting you the report on the Technical Design Authority, or TDA. This report's for noting, and it's to provide DG&S with visibility of our progress, the current priorities and areas that the committee should be aware of since the previous update meeting. That was last November. So as a background context, the TDA itself is DHEW's core architectural governance mechanism. So it's designed to ensure that we have consistent, scalable, interoperable digital services that are delivered by our organisation. It also provides us organisational-wide architectural oversight. As Sam was mentioning, it maintains the architectural principles, standards, patterns, and roadmaps for DHEW. And it also works in partnership with another group called Technical Design Assurance Group, or TDAG, which reports into the TDA, so it's a subgroup of it. And that group provides technical assurance of specific designs and quality, helps resolve escalations, support with national alignment of our strategy. So TDA essentially does the assessment against those blueprints and standards and principles we were talking about, and flags any misalignments, essentially. So the purpose of that group. Progress we've had since last DG&S in November, we've finalised the principles. We've increased some of the transparency and what we've published publicly. I think I spoke at a previous DG&S meeting about how we were publishing updates on publicly accessible website, similar to how these sessions are recorded and the minutes are made available. So we'll continue to mature that and make sure we've got the right information being published in the right way. I'll put some links in the chat in a minute to some of the things that I'm about to talk about so you can see them. And we've continued to improve the processes similar to what we were just talking about with WIAG. You'll note in a previous update, we talked about the introduction of architecture decision records, which are just short form documents that help us capture where we've made particular decisions around architectures for products or services, or how things fit together, or tools or technologies we're going to use. The most interesting aspect of that is the way we've set up the process is to empower teams to come together with the experts who understand the particular topic area and make the decision, and then bring it back to the governance committee for information to say the experts have made this decision, here's what was decided, as opposed to previous methods where the decision was discussed at the committee, like the TDA or TDAG, and the decision was made there. So we're kind of trying to make it more empowered for our teams so they can move ahead at pace, but within the guardrails. So obviously we've set out those principles to work within, setting out blueprints and other aspects so that teams know what decisions they can make autonomously, but with that visibility provided back to us. So there's been 2 key meetings in the last few months. One was a development session in person at DHCW's offices in Cardiff. That was on the 14th of January. And there's also been the first actual TDA meeting of 2026, which was on the 20th of February, so a few weeks ago. The development session itself, we did a whole reflective exercise. We looked at what the TDA had been doing and TDAG had been doing over the last 12 months. I'll go into the details for that, but I'll post the link, as I say, to some of that information which we've made available through our architecture website. But the 4 key things coming out of that, the first one was around governance clarity. So a need for clearer articulation of the relationships between the TDA, the TDAG, YAG, and program governance. I think we've got quite a few different committees and forums, and it's not always clear to all of our teams exactly how all these things fit together and who should I go to for which. And obviously we're also actively making improvements and the Kaizen processes that were mentioned earlier. So it's kind of a slightly unstable ground for some people who are familiar with some of these things over long periods of time. We're trying to improve them, so we just need to be clear exactly how all this hangs together, make sure everyone understands that correctly. Obviously we're doing it all for the right reasons, so it's more of a communications thing in that respect. Second point was around national alignment. So there's a new national architecture and standards board that's been established that reports into the national DDAT board. That's chaired by Mark Wardle and Welsh Government representing that. So we have to make sure that our TDA as an organisational governance around architecture also aligns and fits in with the national board that's now been established. And I'm a member of that board, as are some other DHCW staff. So we'll obviously make sure that happens. It's obviously a priority for us. We also need to make sure that we've got the right, so the third point was around adoption and support of the things we've been talking about. So when we say, well, we've published principles and we're publishing blueprints and standards, we need to make sure that our teams understand these and they've got the right training and the right experience and skills to actually be able to understand what the implications are of those things and to work with them. It's no good us just sending out a Word document and hoping that that's good enough. So I think that's a fair point. And generally, as things are transforming, that's important. And then the final point at that development session was around strategic clarity. So it's just making sure we're focusing on the right core architectural components as an organisation. So we talked about things like identity and demographics, integration, data, and just making sure that's a focus for our architecture community in DHCW. And then the session, the actual TDA session we had in February, that confirmed the priorities for 2026. So the session reviewed what had come out of that development workshop. And there was 5 key things identified as 2026 priorities for our TDA. So one was positioning our TDA in our governance model. So having a review of the terms of reference. So when I mentioned all those different committees, making sure they all hang together, especially with all the changes that are going on, make sure the terms of references are all clear. There's a clear remit for each. The decision boundaries are clear and what the escalation routes are. And obviously, we're trying to actively change some of that, as multiple people on this DG&S session have said, to make them more streamlined, to empower our teams to operate more autonomously, but with safety and security still in mind. And then we need to make sure it's clear for teams how they operate within those governance arrangements. The second point was around national architecture alignment. So establishing that 2-way communication with the new national board. We'll be sure to make sure that happens. And interestingly, just as a point of interest on this, I mentioned that DHCW's TDA had been working on principles, architectural principles. We've been working across the system, across NHS Wales, to get those principles elevated to a national level, and they were discussed at the second Standards and Architecture National Board. There's some minor tweaks and feedback needed, but it looks like those principles are likely to become national level principles, not just for DHCW, which is really good achievement, because it's taken us quite a significant amount of effort to obviously get those into a really good shape, and we've worked with other organisations to do that. So that national alignment's happening, as far as I'm concerned, actively. I think that's really good. Third point was around standards, patterns and blueprints. So I think this has been mentioned already today. So make sure we've got those blueprints developed so our teams can work within those guardrails. Again, it's all about being able to work at pace and do things safely and securely. Fourth point was around strategic architecture components. So this was obviously that thing coming out of the development workshop. We want the TDA to commission more specific work around strategic architectural areas like patient index, demographics, our relationship between our different products and services and how data flows. So it's just a standard part of a TDA, but should obviously be a priority. And then the final fifth point of prioritization was around assessment for business cases. So just making sure the architectural assessment that feeds into a strategic case early on is included throughout the life cycle of those cases. I think in the past it was recognised sometimes it's been late in the cycle where architecture has been involved, and getting it in there early, especially now that we've got these principles agreed and blueprints, we can start to shape cases and make sure that they're aligned with those early on in the process. So no formal escalations to bring to DGNS or risks for that matter. We just have to make sure we've got good alignment on the national work that's going on. Obviously, I'm part of that, so make sure that happens. So I think in summary, 2026 is going to be a pretty pivotal year for us in terms of the foundations we laid last year, clarifying our governance, getting that full national alignment and work with the new national board. And yeah, TDA just really underpins some of the work that we do in DHCW. To answer any questions anyone's got. I'll put those links in the chat as well. Sorry. That's
great. Thank you, Chris. David?
Yeah, thanks, Rowan. Thanks for that update, Chris. One of the things you mentioned in the report was the need for some dedicated resources. And I'm aware from previous updates that Sam's given us that we've done some of this work on best endeavours of people in the organisation over and above their day job. I think this is a really important piece of work, and if we need some dedicated resource, then I think we should get some allocated. Where are you with that need to get some dedicated resource to help you?
I think, yeah, resourcing and recruitment is very challenging at the moment in the organisation. So I don't think we've got a specific vacancy request for that that's approved. I think we'll continue to make a case for this against all the other priorities, obviously, that exist in the organisation. Happy to discuss that with Sam and the others again if we think that it's should be higher up the list. I know sort of Mark on this call will also be banging the drum for cyber resources and others as well. So it's not a unique problem to this particular team or committee. But yeah, no, I appreciate your support in that, David. Also feel it's a very important area that would benefit from, as most areas would benefit from additional capacity.
Okay, thanks, Chris. You have my support if that's worth anything. Thanks.
Yeah, thank you.
Chris?
Thanks, Rowan. Thanks, Chris. It was just on the national governance and the standards and architecture board. So it's great you're on that, Chris, and able to represent DHCW and bring some of our thinking to that group. Just wondered, one, your sense, I know it's early doors, but how that's taking shape and the impact that could have on us, I guess, as an organisation, on the wider system in terms of bringing some of the things that we work on together. And secondly, just on standards, does the terms of reference for that group getting to reviewing adherence to standards? Do you know, or is it too early?
Okay.
If you
Yeah,
don't, it's fine. It's just if you do and you've had those conversations.
Do you mean the national board, Chris? On that one?
Yes, yeah. The national.
Yeah,
government.
I think it's early days for that at the moment. I think we haven't actually agreed to the. It's one of the things that committee needs to do is understand what needs to be submitted to it for approval or review or otherwise. I don't think it's 100% decided yet how that's going to work. Although it's in the terms of reference, so I think we do need to come up with what that process looks like. And the board itself hasn't ratified those architectural principles as an example, so there's almost like nothing to assess against yet. That was the focus of the last meeting, and I think, pending some minor changes, I think, to the wording on some of those, that will then provide us with a set of national principles that any initiatives that go to that National Standards and Architecture Board could be assessed against to check for alignment. Already doing that within DHCW, so any new designs or work or architectures that come through our TDAG process, there's an assessment sheet that says, right, you need to mark off for each of the different architectural principles which you're not complying with. You should comply with all of them, but if you aren't, then your explanation and reason for exception, then that's captured as a technical debt organizational register, so we can track going forward, if we've got these debts and when they're going to be paid off and what's been agreed on that basis. Obviously, those are then made visible to our actual TDA as well. That answers your question.
Yeah, and Chris, I mean, this is a huge amount of work. It's actually a massive investment for DHCW and across Wales. It's overdue in my view. So really pleased to see it happening. I think as critical as the decisions are, the governance of this is even more imperative. Otherwise, we just end up with a sort of degradation back to everyone's, favorite flavor of some quasi standard that thing that almost meets the architecture. So I think one of my comments would be, what is the path to getting that clarity between across the national and our program, the relative governance, who's assuring what adherence to these decision making, because otherwise, it's a slightly kind of constrained set of resources trying to do a massive job, just making sure it's got enough energy in the system to achieve its goals, really.
Yeah, it's a really good point, and like I said,
it's a comment more than a question, really, isn't it?
yeah. I mean, we're starting to pick that up at the national board. Like I said, with that discussion around the architectural principles, and I put a link in the chat now to those, so you can see what they look like. I think that does provide a solid foundation for then moving on from there and saying, well, how do you then assess initiatives against those and whether they're aligned or not? Well, I think we'll have to see how that plays out through that new board. I welcome the first person, team or organisation that submits something for that assessment, because that will definitely be an interesting conversation, I expect.
Yes, Chris. And Sam, you have a comment?
Thanks. Yeah, just to say, it's part of a wider question around, the governance of digital strategy and digital implementation across Wales, I think, isn't it? There currently isn't really a spend control mechanism comparable to the one that I know exists in England to sort of steer the direction of digital investment nationally. So I think, the architecture, the strategy, the spend, these are all different sides of the same cube, as it were. It's part of the same puzzle, isn't it, that we need to solve as a system and as a nation about how we move the digital agenda forward together. I think we haven't fully solved that yet.
And I think Sam, that is absolutely right, and I don't think we've cracked getting everyone behind the arrowhead. Noted, Keith, that all digital professionals in Wales can see how they're moving collectively to a future state, and that means that we're not maximising the return on investment that's being made across the system. So it doesn't matter where the decision is originating from. There's always bits of friction that take effort, which costs money to resolve. So yes, I share that frustration with you, I think. Or I would certainly, if you're not frustrated by it, I am, and I would agree with your observation. Perhaps I won't put thoughts into your mind. I want to note and receive that report for assurance for the purposes of the minutes. I'm going to move to closing this meeting. We're a few minutes late. I think there's no significant items really needed on the chair's report. As usual, we've had high quality reports that we've been able to note with a high degree of assurance. So thank you very much for that. I don't know if there's any other urgent business before I close the meeting. No, other than for me to reflect on that, this is my last meeting in the chair's seat. I want to put on record my thanks to all of you over the last years for your, relentless willingness to engage in challenging conversations occasionally. Certainly in the private session, we deal with some very thorny issues, and the openness with which everyone engages with those conversations, I've really appreciated. The work that that we do at this committee, particularly around information governance, is foundational to building trust in terms of how people's information is shared across the NHS in Wales for the purposes of care. From my perspective, it's a huge honour to be trusted with that information. So making sure that that's used thoughtfully and in the way it was intended is central. If we lose that, we lose the ability to improve the quality of care using digital tools. So I think it's really important. So you have my heartfelt thanks for the way you've all approached this, and I wanted to put that on record. So I will be stepping down from my role as an independent member at the end of this month. So the date of the next meeting for this adventure, you'll all go on without me, and you will do incredibly well, will be the 18th of May. So I wish you all well, and don't stop with what you're doing. It's all very important. So thank you very much for that. I will see you at just gone 25 minutes past to step up with the private session. So thank you very much. See you in 10 minutes.
Thank you.